Hello, my name is Dr. Joe Childs. I'm a board-certified chiropractic neurologist, and I've been in practice here in Chester County now for the last 13 years. The name of our practice is Corrective Chiropractic Neurology Accident and Injury Center. And this video is specifically made for attorneys that deal with personal injury patients, especially those that have been injured in motor vehicle accidents. This short video is going to reveal information to you that you need to know that will help you increase your settlements that you can obtain for your clients who have been injured in car accidents, especially the low-speed car accidents. Because many attorneys are afraid of taking these cases, especially those where there's low property damage. This video is going to lessen that fear. So what we're going to talk about today is we're going to talk about the diagnosis and documentation of ligament injuries following motor vehicle accidents. We're going to talk about injuries, soft tissue injuries to the ligaments of the spine. Now, what is the weakest link in most personal injury cases? What's the weakest link, you would say, especially the low-speed cases? Well, number one is the lack of objective proof of injury. If you don't have any proof of injury, it's really hard to get a large settlement for your patient who you know has been injured. You know they're in chronic pain, but there's no objective proof. So we're going to talk about that today. When we talk about no objective proof, we're looking at the standard run-of-the-mill cervical MRI that you send your patient out to. A lot of times these standard MRIs are negative. Patient's been in a low-speed, low-impact collision, and we send them out for an MRI. There's no herniated discs, there's no bulging discs, so there's really no evidence of why this patient's in pain. But there really is evidence. The trouble is they're not doing the correct MRI. Not that they shouldn't do that type of MRI, but there's another type of MRI that we're going to talk about that's going to give you objective evidence of damage in the spine, especially to the ligaments. So if you have no objective proof, you may find out that the x-rays are negative, which in most of these cases, if there's no fractures, the x-rays are negative. There's no objective proof. And then a lot of times what will happen is if it's low speed and there's not much property damage, that's really going to seem like there's not much proof of injury. However, we know that that's a myth. We know that there is no correlation between injury to the patient and how much damage there was to the car. Okay? So what happens is attorney settles for much less than what the patient really deserves because they're concerned. There's fear. They're concerned that they're not going to be able to have an adjuster or a jury believe that the patient is injured, even though they know that the patient's injured. So what happens is this leaves the victim uncompensated for the hidden ligament injuries that are going to cause them chronic pain for the rest of their life, potentially for the rest of their life. We'll talk about that. Now, plaintiff attorneys have been clobbered by this. They've been hammered by this. And the reason why is because a lot of these verdicts are going against the plaintiff attorney. And what's happening is the plaintiff attorney is settling for a lot less than what the patient really requires or needs because there's no objective evidence. We're going to give you objective evidence. We're going to talk about how you can have evidence and you can actually show these injuries. Now, what happens is the adjusters, the jury, well, not really the jury, but the adjusters from the insurance companies, they prey on what's considered the common sense argument. And really the common sense argument is really what we call junk science. It's myth. Okay, but they use it. Myth number one is if there's low property damage, there can be little to no injury. We all know that that's not true. I mean, I don't call the auto body shop to find out how much damage the car has had to figure out what I need to do to the patient. Okay, there's plenty of research. I could do a whole video on how low property damage has no correlation to injury. Okay, that's myth number one. But it's the common sense. Hey, if it was a slow and there's not a lot of damage to the car, person must not be injured. Myth number two, it's only a minor soft tissue injury, right? That's what they say. However, what you need to understand is that the soft tissues that are injured are very pain sensitive. They're the ligaments in the upper cervical spine. The trouble is the typical cervical MRI only looks at the discs in the spine and it doesn't look at these cervical ligaments. Okay? And myth number three is soft tissue injuries heal in just 6 to 12 weeks, so there should be really a small settlement. This patient should be fine. And I find that to be absolutely not true in my practice. I have a lot of patients that come in for chronic conditions, and a lot of these patients that come in with chronic headaches and vertigo and chronic neck pain, they'll say to me they've had chronic neck pain for the last 30 years. Since that car accident back in 1970, they've never been the same. So this information we're going to talk about today is really science catching up to what we've seen in practice over many, many years. People that have had car accidents have higher incidence of chronic pain. Okay? Soft tissue injuries, ligament injuries, they're permanent, they're progressive, and they're very painful. Now you all heard about the All-State MIST division, the Minor Impact Soft Tissue Injury Division. I mean, they have a specific type of adjuster that deals with these cases, and their goal is to hammer these cases to the ground so that the settlement is as little as possible. They're trained to do that. What I'm going to do today is I'm going to teach you about a soft tissue MRI that's going to give you the objective evidence you need to show the injuries in these people's spines who have had these whiplash injuries. Okay? It's going to be the proof that you need. Okay, it's very exciting. It's incredible science. Again, it is science. It's not fluff. It's not junk science. This is, like I said before, this is science catching up to what we've seen for many, many years. So let's talk a little bit. Let's talk a little bit about the minor impact low speed first. First off, you need to know that 80% of car crashes are less than 20 miles an hour. So 80% of the people that are getting injured, they're getting injured in less than 20 miles an hour. Because of the lower speed, the standard run-of-the-mill cervical MRIs are not showing disc herniations. We're not developing disc herniations from that. The disc is fairly strong. It needs to be a little bit more high speed. Or fractures. So the case is considered a minor impact soft tissue injury. Boom, low settlement, right? Missed injuries leave victims in pain and uncompensated. The structures, this is the important thing to understand, the structures that are being injured in these types of accidents are the cervical spinal ligaments. These ligaments are very pain sensitive. You need to understand that. Now, why are there so many more whiplash injuries from minor impact low speed injuries? Well, you're seeing more and more of them. Well, we've got stiffer cars. The reason why we have stiffer cars is because the Insurance Institute of Highway Safety is making these car manufacturers make stiffer cars because the insurance companies want to have less damage to these vehicles. The stiffer car means that the impact, the energy from that impact actually doesn't affect the car, but it goes right through to the patient, okay, or to the driver. We have stiffer seats than we've ever had before. We have increased seatbelt use. Now, everybody should use a seatbelt, but when there's low impact and low speed, actually seatbelt use can actually create more of a transfer of force to the neck, and so we're getting more injuries there because more people are wearing their seatbelt, and rightly so, they should. Improperly positioned headrest is the other thing. They say that up to 30% of people actually don't even use their headrest properly. So this is the reason why, again, we could do a whole seminar just on this information. What we need to do is we need to reframe the issue of the soft tissue injury or the minor soft tissue injury, because most of these cases are actually partial ligament tears. Okay? They're tears to the upper cervical ligaments. It's kind of like a torn ACL. Now, you as a personal injury attorney know that if you find that somebody has slipped and torn their ACL, or they're in a car accident, you have objective damage or objective MRI evidence of, hey, they didn't have a torn ACL before the accident, they have it now. I mean, that's a slam dunk case for you because you can see the ligament damage. You have objective evidence. Well, in the spine, in the upper cervical spine, way up in here where the occiput, which is the skull, C1 and C2, there's ligaments up there that become damaged, torn, and partially torn, just like an ACL. The difference is between a knee and the spine is this is a very, very complex joint. I mean, there is multiple joints in the upper cervical spine. There's multiple movements up and through here. The knee is just a hinge joint. And so these are very easy to fix, where patients that get these up in here, you can't really do many surgeries for these ligaments unless you fuse it. So when you get these partial ligament tears, people get instability and chronic pain. We're going to talk about that. Today's topic, again, is going to be objective imaging of soft tissue ligament injuries in the spine. We're going to show you exactly some of these views. Partial ligament tears, the 3 Ps, they're painful. Ligaments are not just rubber bands. Ligaments have nerves. They have pain nerves, they have position nerves, and so these are highly pain-sensitive structures that when they're partially torn, they can create permanent pain. They're progressive. It's been shown that if there's any instability in the spine from these partial ligament tears, that's going to lead to future disc and spine degeneration. Okay, so it's going to cause a lifetime of degenerative changes much quicker than would happen without the accident. They're permanent. The guides to the AMA impairment rating, which we use in our office, say that ligament injuries are rated in the same category as disc herniations, again, produce permanent impairment. It's right in the AMA guidelines. But if you can't diagnose them from objective proof, all that's out the door. We're going to talk about the objective proof that you need. You need to know that there is objective imaging. We're going to talk about that to look at these painful and progressive injuries. There's MRI of the soft tissue injury. It's called a proton density weighted scan. It's a different type of scan than you get to just analyze the discs in the spine. The guy that did the research, the doctor that did the research on these scans, his name is Krakins. He's the godfather of upper cervical MRI, soft tissue MRI. And he's done a lot of research. We're going to talk about some of the research papers today. He discovered common changes in the upper cervical, I'm talking C1, C2, and the occiput, which is the bottom of the skull. He found common changes in the upper cervical ligaments post-motor vehicle accident. This is a paper from the diagnostic neuroradiology. Again, this is not fluff. There is incredible research in this. And let's take a look. MRI of the alar and transverse ligaments in associated disorders, WAD injuries, grades 1 and 2, show high signal changes by age, gender, and event and time since trauma, which means that there's actually damage in the ligaments, in the alar and transverse ligaments. The conclusion was high signal changes of the alar and transverse ligaments are common in whiplash-associated disorder type 1 and 2 and unlikely to represent age-dependent degeneration, meaning it came from the trauma. This is coming, it's another research paper from Spine, Magnetic Resonance Imaging Assessment of Craniovertebral Ligaments and Membranes After Whiplash Trauma. What they found was the number of high-grade changes in whiplash patients compared with the non-injured individuals indicates that these lesions are indeed caused by whiplash trauma. Our findings add support to the hypothesis that injured soft tissue structures in the upper cervical spine, particularly the alar ligaments, we're going to show you these ligaments, play an important role in the understanding of the chronic whiplash syndrome. This came from Diagnostic Neuroradiology, MRI of the tectorial and posterior atlanto-occipital membranes in the late stage of whiplash injury. The conclusion of this study strongly indicates that whiplash trauma can damage the tectorial and posterior atlanto-occipital membranes. This can be shown on high-resolution MRI. Only high-resolution MRI that looks at these ligaments. The same type of MRI that they use to look at the ligaments in the knee, they do it in the neck. This Dr. Krakins, he did a chapter in the book Whiplash Injuries, and the conclusion from that chapter, and where he goes over the exact way that you do these types of MRIs, which we have local MRI centers that are doing these for us, for our injured patients. The proposed MR protocol allows a detailed assessment of the craniovertebral, meaning the ligaments that come down from the skull to the vertebral column. The articulations, meaning joint, have shown that whiplash injuries cause substantial signal changes, meaning damage to the ligaments, in the craniovertebral ligaments and membranes. The conclusion, such lesions, especially in the alar and transverse ligaments, are associated with pain and disability. Okay? We have also shown that specific injury mechanisms cause specific lesions, so specific head positions, and is it coming from a rear impact, a front impact, a side impact, can affect different ligaments in the upper cervical spine, which are some of the most pain-sensitive ligaments in your body. Whiplash-associated disorders and impairment ratings. What they found is that the whiplash-associated disorder patients, the MRI lesions to the alar ligament showed that the most consistent and associated to the reported pain and disability. Lesions to the other structures are often occurred in combination with lesions to the alar ligaments. Lesions to the transverse ligament and to the posterior atlanto-occipital membrane, which I know this is a lot of scientific language here, but I'm going to show you these ligaments in detail, also appeared to be related to the NDI score. Okay, most consistent associated reported pain and disability. So meaning the more damage to the ligaments, the more pain and disability you have. Some of these cases that you've tried or have been, some of these clients you've had, and you've not had this information, you've given them settlements, even though that are much less. They're for peanuts based on the fact that these injuries are hidden and they're not being diagnosed, they're not being documented. So what are the key points? When it comes to low speed, low damage crashes, 9 out of 10 times regular cervical MRIs come out negative for disc herniations and fractures. Now we still run those MRIs because if we find those things, they're important as well. The pain generator is the partially torn upper cervical ligaments. Ligaments are very pain sensitive, and when torn can cause chronic, progressive, and permanent neck pain, and neurological symptoms such as headaches and dizziness. Okay? A lot of your patients are complaining of these things, a lot of our patients that come in. The discs in the cervical spine are located in the lower 70%. You only have discs down here from C3 in the cervical spine down to T1. You don't have discs at occiput C1 and C2. Again, there's no disc there. Regular MRIs miss the upper 30% of the spine, whereas that's where these painful ligaments are, so they're completely missed. Regular MRIs only look at the lower 70%, the anterior 70%, and look at the discs in here. They miss these injuries. They're not actually the proper scan to look at those ligaments. Alright, so what we're going to do now is we're going to zoom in so I can show you some of these ligaments, and that way I can kind of point out what a healthy ligament, what a torn ligament looks like, so you can have a better understanding of what we look for when a patient comes in with chronic pain from a motor vehicle accident. Okay, what we're going to do now is we're going to show you some of these ligaments. And basically what you see here is a side profile of the cervical spine, and we're looking at pretty much, as we look here, C3, C2, C1, and the occiput again, which is the lower part of the skull. This is the lower part of the skull, lower part of the skull. There's a hole in the bottom of the skull where the spinal cord comes through, and then there's a lot of different ligaments. There's ligaments that come down right through here from the side. This is called the anterior atlanto-occipital membrane, which can be damaged in a whiplash injury. Posterior atlanto-occipital membrane, which comes down from the back of the skull and connects into the back part of the atlas, which is the top bone in the spine. Okay, so that's your side view. If we look at this side view here again, this is the anterior atlanto-occipital membrane. This is the posterior atlanto-occipital membrane. Now, healthy ligaments are black. Unhealthy, damaged ligaments show up gray on these scans, on these soft tissue MRIs. So here is an example of a section of normal posterior atlanto-occipital membrane. It's the dark black color. Again, that's a healthy. If you look in here, this is where there's tearing of the posterior atlanto-occipital membrane, which can create chronic pain in your client. Now from the front, if we're looking at it from the front here, what we're looking at is we're looking at the atlas and the then actually this is the occiput, the atlas in through here, and this is C2, this is the dens, and a part of this is kind of cut away so you can see, but these ligaments that attach to the dens from C2, it comes up and attaches to the side of the skull. They are called the alar ligaments. And normal alar ligaments are going to show up black right in through here. Okay? Here's an example of a normal alar ligament, but if you look in here, the graying in here is damage to the alar ligament. So what we're having is we're having partial tears in here. That can create instability and chronic pain. Even if it's just a grade 1 sprain, these things here can be pain sensitive for a very long time. These ligaments in here have a lot of nerves in them because the movement of your head is essential to have a lot of nerves. So they can be very painful. Now looking at the atlas from the top, if you're looking at it from the top down, so it's kind of like looking at the spine in from this way down. This is the dens or the odontoid process. This is the transverse ligament, which basically holds your neck together in a sense. It basically holds C2 to C1. Okay. This is normal. You can see it's black in through here, normal transverse ligament. Here is normal transverse ligament. As we come in through here, we can see the light gray. That's damage or tearing of the transverse ligament. Again, that can create a lot of issues with the patient. And this is an example of what it would look like if it was torn. Now, it's not completely torn, but it's partially torn, which makes it incredibly pain sensitive. Those patients that have complete tears of some of these ligaments are going to have incredible instability that we can see on flexion extension x-rays, or we can also see them on A to P open mouth lateral bending x-rays, or sometimes we'll use what's called video fluoroscopy or digital motion x-ray, which will actually show some of these complete tears. When we do flexion extension MRIs and flexion extension x-rays, we can analyze if there's any instability in the vertebra. So basically what's happening here, this is a flexion view. This is an extension view, which we're going to do x-rays that way, and we'll also have our MRI studies done that way. If there is a widening of the discs in the back, that indicates that there's been damage to this long posterior ligament, which can happen when there's a whiplash injury. It can become stretched, and if that happens, you're going to see gapping on flexion. Okay, that's the back posterior longitudinal ligament. You can see it right in through here, what the damage looks like. This is partial tears then through there. Again, if there's a full tear, you're going to have a huge gapping on a flexion extension film. And if you have anterior gapping, that can happen from a hyperextension injury. You're going to have gapping in the front here, and that's going to be widening of the anterior disc spaces that's going to indicate damage to the anterior longitudinal ligament. A lot of your patients have this going on, but if they don't run the flexion extension films, they don't run flexion extension MRIs and soft tissue MRIs, there's no idea, there's no way you know that this is occurring. You have no objective proof. And then a lot of times we'll get what we call retrolisthesis, and that's when one of the vertebrae slides backwards on another, and that's from damage to the posterior longitudinal ligament. You actually have slippage of these vertebrae. We can see these on plain film x-ray, flexion extension as well. All right. And so that's an example of the anterior longitudinal ligament being torn. We can do what's called lateral bending. And lateral bending, what happens is when we do lateral bending, we're checking to see, and we'll do this ahead of time before we even send out for a soft tissue MRI. We want to see if this upper cervical C1 is stable on C2, and the alar ligaments are keeping it that way. But if we bend and we see a slippage, if we actually see that C1 slides off of C2, and we get this gapping in here, what that will be indicative of is potential stretching out or damage to these alar ligaments. Again, we'd want to do a soft tissue MRI in that instance. But what I want to talk to you now is our algorithm as to when to refer out for these soft tissue MRIs. It always comes up when talking to attorneys, whether we're out to lunch with them or on the phone with them talking about a particular client or patient that we're dealing with, is, when do we refer out for these soft tissue MRI films? Because sometimes we don't need to do that. So there's an algorithm to it. So let's talk about this. Number one, if there are radicular symptoms, which means numbness, tingling, weakness, atrophy, down into the arms, down into the legs, then we're going to send out for just a regular MRI. So if a patient is in need of a typical cervical MRI for arm pain, tingling, weakness, diminished reflexes, we're also going to image the upper cervical ligaments at the same time. Why not? If we have them at the center, getting their discs looked at with a typical MRI, cervical MRI, we might as well look at the upper cervical MRI, because a lot of times if there's enough damage or force to damage the disc, there's enough force to damage some of these upper cervical ligaments as well. And we're set up with various local MRI centers that have actually combined these two for us at a lesser cost. So we can get both of these done at the same time. So again, any radicular symptoms, anytime I would refer out for a regular MRI, I'm definitely going to get the upper cervical MRI. Any patient that has x-rays that show instability or ligamentous laxity, so if we do the lateral bending A to P open mouth views that we talked about, and we see that gapping between C1 and C2, that's going to let me, it's a little hint that there may be some ligamentous instability or ligamentous damage, and so we're going to want to do that right away in that case. Again, we're going to do the typical Davis series when they come in, unless they've had them at the hospital. The other thing is if we do a flexion extension film and we see some of that gapping or we see some of that anterior slippage or posterior slippage, then we're going to send them out, because that's a big clue that there is some ligamentous damage in the spine. We're going to send out and take a look at those. And the other time we do it is if we're dealing with a patient that has chronic neck pain or chronic neurological symptoms and it's unresponsive to care. I mean, we're doing everything we can and they still have chronic neck pain, or they've had an old accident and the pain is just not going away. Well, in that case, we're really thinking that maybe it's not just a muscle problem. It's not just a stretch of some of the muscles and things of that nature. Maybe the soft tissue injury is of the ligaments. And so what we'll do is, after we do a conservative course of care of maybe 4 to 6 weeks, and if the patient's not doing better from a chronic pain standpoint, especially in the upper cervical neck, what we're going to do is we're going to send out for one of these soft tissue MRIs. So again, that is the big reason, or the algorithm for sending out for these particular types of studies. Okay. Now, that's it for today. So I think that's some pretty exciting information. If you have any questions about it, you can certainly call our office. I'll give you the number here at the end. But I also want to let you know that I'm going to be doing upcoming videos. My next video I'm going to be doing is on documentation that turns your records into value drivers. There's some documentation that doctors miss that is essential. Number one is we're going to do a form called a loss of enjoyment of life form. We're going to also do a form called duties under duress. Duties under duress are things that these clients or these patients are doing that they're just, I mean, they're able to do it, they're able to work, but it hurts. Okay, and we have various forms that are gonna look at that. We do those forms every single re-exam, and when they first come in. Loss of enjoyment of life are the things that they can't do. We're going to document these things. The other thing we're going to talk about is the different types of injuries and associated symptoms that are missed by most doctors. Me being a chiropractic neurologist, I'm going to do a very thorough neurological exam, and a lot of times I'm going to look at and find injuries that are missed, such as ligamentous laxity, which we just talked about in great detail, ligamentous injuries. Bruises and concussions are essential. A lot of times doctors will come in, the patient has bruises, we're going to document that. We're going to take a picture of that bruise, we're going to document that as best we can. And then, of course, coming from the neurological standpoint, which is my favorite thing, being a chiropractic neurologist, is we're going to look at post-concussion syndrome. In our office, we treat a lot of post-concussion patients, and we do it without drugs or surgery. But a lot of times patients are dizzy after a motor vehicle accident. They have vertigo, spinning. They may have broke a crystal off in their inner ear. They may have a traumatic brain injury, you know, not from actually going through the windshield, but just that sloshing of the brain inside the cranium. They may have jaw issues. They may have post-traumatic headaches or anxiety. These are things that we're going to document, and we're going to look and see if there's any neurological basis for this that could be caused from the accident. In fact, right now I'm dealing with a post-concussion patient. She got a concussion from the accident. She's got chronic neck pain and whiplash injury, but she also has a post-concussion injury. So I'm going to have a new video on that. So look for those. We may be mailing those out to you. So if you have questions about this, if you want to learn more about this soft tissue MRI that can diagnose some of these injuries, you can give us a call at our office, 610-518-3370. You can go to our injury-specific website called ChesterCountyAutoInjury.com. You can also take a look at our regular website, which is www.askdrchildsdrdur.com. Dr. Durr is my partner. Again, I've been in practice with him for 13 years. And again, our office is Corrective Chiropractic Neurology Accident and Injury Center. So if you have any questions, don't hesitate to give us a call. If you'd like to set up a time to maybe go to lunch and discuss documentation and some of these things that we've talked about, don't hesitate to give us a call. So thank you very much. Take care.